Assalamualaikum. My name is Imran bin Ibrahim. I'm a bachelor student in medical and health science. For this sem, I have completed my clinical practice for the subject mental health care at Jabatan Psychiatric Hospital Tuanku Ampuan Najihah, Kuala Pilah. For this subject, I have done my case study for the topic drug-induced psychosis, and the drug is cocaine. Drug is generally a cure for variety of illness and to reduce or eliminate the sign and symptom of the illness. According to Agensi Anti-Dadah Kebangsaan 2020, statistic from January to June 2020, there is 95,505 number of drug and substance abuser and addicts. To diagnose patients with drug-induced psychosis, psychiatrists need to ensure the symptom occurred must be typical symptoms that are commonly caused by a drug use. This case study will focus more to cocaine as a substance that induces psychosis. Cocaine may be a powerful addictive stimulant made up of the leaf of the coca plant native to South Africa. Cocaine affects the brain function by increases level of the natural chemical messenger dopamine in brain circuit associated with the control of movement and reward. Normally, dopamine recycles back to the cell that releases it, shutting off the signal between the nerve cells. However, cocaine prevents dopamine from being recycled, from causing large amount to create up within the space between two nerve cells, stopping their normal communication. This flood of dopamine within the brain reward circuit strongly reinforces drug-taken behavior. For the short-term physiological effect of the cocaine, constricting blood vessel, there is dilated pupil and increased body temperature, heart rate and blood pressure. Large amount of cocaine may intensify the user high but can also lead to the seizure, erratic and violent behavior. Some cocaine users report feeling of the restlessness, irritability, anxiety, panic and paranoia. Users may also experience tremor, vertigo, and muscle twitches. Several medical complications can occur with cocaine use. Some of the most frequent are cardiovascular effects, including disturbance in heart rhythm and heart attack. Neurological effects including headache, seizure, stroke and coma, and gastrointestinal complications including abnormal pain, nausea, and vomiting. Presentation of the case. For the first is the demographic data. This patient is called as Mr. Zack. Is a male person, 21 years old, is a Malay, and his religion is Muslim. Patient was not married. Patient occupation is a rubber tapper, and patient living at Taman Jemapuh Murni, Juasih, Negeri Sembilan. For the examination, the doctor has done the mental state examination to obtain history from the patient and by his parent. The chief complaint of the patient is abnormal behavior that noticed by his parent. History of the present illness of the patient was patient abnormal behavior for the last 2 weeks. Patient doesn't want to eat at home because he thought that his mother put poison in his food. This symptom is similar to the paranoia symptom. Patient having an insomnia for 2 weeks. No aggressive behavior noticed by his parent. No suicidal attempt by patient. Parent brought the patient to the emergency department due to his abnormal behavior for the last 2 weeks. Urine drug taken by the emergency department and found that patient was positive in cocaine. History from relative was taken from his mother. His mother claimed that the patient behavior became abnormal for the last 2 weeks. Patient having paranoid delusion for the past 2 days claimed that his mother tried to kill him because patient caused a lot of problem to his family. Patient doesn't want to eat at home because he claimed that his mother put poison in his food. Mothers know that the patient consumed drug substance from his friend. Patient was living together with his parent. Okay, list of complaint that found during the mental health examination is paranoid delusion for the past 2 days, that patient claim his mother tried to kill him. Patient also have insomnia for the past 2 weeks and behavioral changes for the past 2 weeks. Patient ability of work was a rubber taper. Sleep pattern of the patient is insomnia for the past 2 weeks. Patient have a good appetite. Patient have a toilet good habit, and patient have no seeken for any treatment before. Okay, family history. Patient father was 56 years old, diabetic, and diagnosed with diabetic and hypertension. Patient father has no history of mental health disorder. Patient father working as a rubber taper at the Juase. Patient mother was 50 years old, not non-medical illness, and also no history of mental disorder. Patient mother was a teachers before and has quit around 10 years back. Patient also have a sister, and the age of his sister is 26 years old. His sister has no medical illness before and no history of mental health disorder. Patient's sister was married and living separately. Which patient? Okay, personal history of the patient. Patient was born spontaneous vaginal delivery, no other complication during birth and growth. Patient has normal childhood, no neurotic problem and health in childhood. Patient was attending the government primary and secondary school. Patient has moderate academic record during his school. Patient social activity was normal. On examination and grade during school was moderate achievement. Patient work record patient help his father at a rubber taper. His salary is around 700 to 800 ringgit per month. Patient have no sexual experience and no history of marriage. Currently, patient was living with parent at Taman Jemapuh Muni at Juase. Patient have limited circle of friend. Patient religion is Muslim. Patient also have a active smoker habit since 15 years old. It's around 1 pack for 2 days. Patient never took alcohol but admit that used recreational drugs such as cocaine since age of 20 years old. Patient has no medical history before. Patient also have no psychiatric history before. On physical examination, all vital signs of the patient was stable. On cardiovascular examination, dual rhythm, no murmur, no muffled heart sound heard. On respiratory examination, equal entry, no abdominal breathing sound during auscultation. On abdomen examination, abdomen was soft and not tender. On central nervous system examination, patient GCS was 15/15. During case clerking, the doctor has done the mental state examination, and the mental state examination finding was on general appearance and behavior. Patient was Malay, guy, slim and young, alert and able to respond to questions coherently. Patient was tidy, neat and clean. On facial expression and posture, look that patient have anxiety looking and poor oral contact with the doctor. Patient also have poor response to surrounding and not respond to question immediately. Patient can cooperate to the clerking process wisely. On the top, patient using a Malay language with a good pronunciation and grammar. Patient also can answer all the questions given to him. Patient able to speak rationally, relevant and coherent. Good response on question asked by the doctor. Patient have no flight of idea. Patient have no talk block during the case clerking. Patient can clearly mention his problem. Patient can answer spontaneously according to the question asked. Some of question decrease tone and rate. No triggering factor aggressive behavior during case clerking process. On patient mood state, the patient was calm and not in aggressive mood or tense. Patient have effective response. Patient able to consistent his mood all the time during the clerking case process, during observation. Patient show no withdrawal syndrome during the clerking process. Patient talk content was patient no sign of delusion during case clerking process, but claimed that his mother put poison in his food 2 days ago. Patient no feeling of influence, no feeling of passivity, no hypochondriac sign and symptom, no hallucination during the case clerking, no preoccupation, no suicidal talk, no overdetermined ideas, no repetitive dream, but patient also not show any obvious obsession or phobia during the case clerking. On the memory examination, for the remote memory, patient able to mention his IC number correctly and remember his mother's name. For the recent memory, patient was asked a few short sentences such as baju saya baru. Patient able to remember present sentences given to him. For the immediate memory, patient able to recall immediate memory. And for the 5-minute memory test, patient given word that saya suka main bola. Patient able to mention coherently about previous word asked by the doctor after 5 minutes. On the attention and concentration of the patient was focused during assessment occurred and no distractibility detected. Patient able to answer all the questions have been given to him well. On the patient have the good judgment and the good insight. After completed the mental state examination, the doctor come with the differential diagnosis, and that is stress-induced schizophrenia, major depressive disorder, and bipolar mood disorder. The primary diagnosis for this patient was drug-induced psychosis, and the drug is cocaine. So management and patient care for the patient. Patient was allowed discharge from emergency department with the TCA to the psychiatric department on the 2nd August of 2021. Patient discharged with lorazepam 1 mg on or PRN to help patient sleep on the night and to overcome his insomnia. Psychoeducation also given to the patient and the family member. Patient was discharged to his family member. On the conclusion, drug-induced psychosis is a common mental health problem that occurs among the young age citizen. Drug-induced psychosis could seem self-explanatory and on the cause psychotic symptoms are brought on by substance abuse. However, things isn't always so simple. Drug can affect different people during a sort of way, and way may cause psychotic symptoms in one person might not in another. It is impossible to mention with certainty exactly how a substance will impact each person's psychological state. So to overcome this issue, everybody including family member, community, healthcare worker and government has to play their role effectively. Healthcare workers such as doctor, nurses, assistant medical officer should be able to detect patients that having a drug-induced psychosis in a very early stage. In order to achieve that, healthcare worker that deal with mental health disorder patients should be able to perform mental state examination (MSE) effectively. This is because MSE will help healthcare worker to understand patient appearance and behavior, speech, mood, talk, perception, delusion, cognition, and insight so that a proper treatment can deliver to the patient. That is all about my case study. So, thank you.